Doxylamine is a medication that is commonly used to relieve symptoms of allergies, hay fever, and the common cold. It works by blocking certain natural substances in your body, which helps to alleviate symptoms such as watery eyes, runny nose, and sneezing. Additionally, it can also help you relax and fall asleep. It's important to note that cough and cold products containing doxylamine have not been proven to be safe or effective in children younger than 6 years old. It's essential to follow the doctor's specific directions before using this product for children younger than 6 years old, and do not give the 25 milligram tablets to children younger than 12 years old unless directed by the doctor. It's crucial to carefully follow all dosage directions to decrease the risk of serious side effects. This product should not be used to make a child sleepy, and it's important to avoid giving other cough and cold medications that may contain the same or similar ingredients. Be sure to consult with a doctor or pharmacist for alternative ways to relieve cough and cold symptoms, such as staying hydrated, using a humidifier, or using saline nose drops/spray. The optimal timing for taking Unisom sleep aid is before going to bed, as it can help you relax and fall asleep. Be sure to consult with your doctor or pharmacist for more details about using this product safely. When taking Unisom sleep aid, make sure to follow the directions on the product package. If your doctor has prescribed this medication, take it as directed and ask for help if you have any questions. You can take this medication by mouth with or without food, and if you experience stomach upset, you can take it with food or milk. If you're using the chewable form, make sure to chew thoroughly and then swallow. If you're using the liquid form, be sure to measure the dose carefully using a special measuring device/spoon, not a household spoon. The dosage of Unisom sleep aid is based on your age, medical condition, and how you respond to the treatment. Don't increase your dose or take it more often than directed. To help you sleep, take this medication about 30 minutes before bedtime. If you continue to have difficulty sleeping for longer than 2 weeks, contact your doctor for further guidance. And if your condition lasts or gets worse, or if you think you may have a serious medical problem, seek medical help right away. Some common side effects of Unisom sleep aid include drowsiness, dizziness, headache, constipation, stomach upset, blurred vision, decreased coordination, or dry mouth/nose/throat. If any of these effects persist or worsen, contact your doctor or pharmacist. If your doctor has prescribed this medication for you, it means they have determined that the benefits outweigh the potential side effects. Many people using this medication do not experience serious side effects. However, it's important to immediately inform your doctor if you experience any serious side effects such as changes in mental/mood, ringing in the ears, difficulty urinating, easy bruising/bleeding, or irregular heartbeat. Seek medical help right away if you experience a seizure or any signs of a serious allergic reaction, such as rash, swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects not listed here, make sure to contact your doctor or pharmacist. As for the best time to take Unisom sleep aid and the recommended dosage, it's important to follow your doctor's instructions. Always consult with your healthcare provider for personalized advice on the appropriate use of this medication. It's important to talk to your doctor or pharmacist before taking Unisom sleep aid if you have any allergies or medical conditions, such as breathing problems, eye problems, heart problems, high blood pressure, liver disease, seizures, stomach problems, an overactive thyroid, or urination issues. This medication may cause dizziness, drowsiness, or blurred vision. It's important to avoid driving, using machinery, or doing anything that requires alertness until you know how this medication affects you. Alcohol and marijuana can also increase these effects, so it's best to avoid them while taking Unisom sleep aid. If you experience dizziness or lightheadedness, it's recommended to get up slowly from a sitting or lying position. If you have diabetes, it's important to be cautious with liquid products that may contain sugar. Older adults may be more sensitive to the side effects of this medication, and it may increase the risk of falling. Children may also be more sensitive and may experience agitation or excitement instead of drowsiness. Unisom sleep aid is considered safe to use during pregnancy, but it's important to consult with your doctor before using it while breastfeeding. It's important to be aware of potential interactions with other medications and substances while taking Unisom sleep aid. This includes other antihistamines, opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, and other antihistamines. It's also important to check the labels on all your medicines, as they may contain ingredients that cause drowsiness. Additionally, Unisom sleep aid may interfere with certain lab tests, so be sure to inform lab personnel and your doctors if you are taking this medication. If you or someone else has taken too much Unisom sleep aid and is experiencing severe symptoms like passing out or difficulty breathing, it's important to call 911 right away. Otherwise, contact a poison control center for assistance. In the U.S., you can reach a local poison control center at 1-800-222-1222. Canadian residents can call a provincial poison control center. Symptoms of an overdose may include dilated pupils, flushing, fever, hallucinations, weakness, tremors, muscle twitching, loss of consciousness, and seizures. In children, excitement may be the first symptom, followed by loss of coordination, drowsiness, loss of consciousness, and seizures. Remember to keep Unisom sleep aid out of reach of children and pets to prevent accidental overdose. Before taking Unisom sleep aid, it's important to avoid using it for several days before allergy testing, as it may affect the accuracy of the test results. It's also essential to keep all medical and lab appointments while using this medication. Unisom sleep aid is used to treat insomnia, helping people fall asleep faster and stay asleep longer. It is also used for temporary relief of sleep disturbances. The recommended dosage is 125 mg tablet at bedtime. It should be taken with water and can be taken with or without food. It is important to take it only when you can get a full night's sleep of at least 7 to 8 hours. Taking it too late at night may cause drowsiness the next day. Make sure to check the storage information on the package and keep all products away from children and pets. Do not flush the medication down the toilet unless instructed, and properly discard the product when it is expired or no longer needed. It's best to consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.